Good morning. Okay, I'm going to keep an eye on the waiting room, but we are going to get started here. Good morning and welcome to our first day of our Healthy Aging and Fall Prevention Virtual Summit. We are happy to have you all here joining us this morning. This will be a week-long event. So today is our first day of our Healthy Aging and Fall Prevention Virtual Summit. So here is our schedule of events for the week. So you can see other sessions that will be going on this week. If you wanted to pop in and join some of those sessions, that is our schedule. And again, you'll use this same meeting ID and password for each session. So just letting you know about that. So some different things happening this week. Tomorrow we'll be meeting at 11 o'clock. So please also note the time difference. Today, so our first day of our Healthy Aging and Fall Prevention Summit. So we are going to be talking about diabetes, heart health, and stroke. And I have Anne Stokman here with me. So she is our expert for the day. So I'll be handing it over to Anne in just a little bit. So she can give us a well-rounded presentation on diabetes. I do want to also mention that this meeting is being recorded. I will also have videos off just so we can get the best quality for this session. And everybody will be muted. So if you do have questions, you can put them in the chat box and I will let Anne know those questions when we get to the Ask the Expert part. I want to mention that we do have some really great sponsors for our Healthy Aging and Fall Prevention Summit. This wouldn't be possible without Kaiser Permanente and Stanislaus County Area Agency on Aging. But we are so grateful for all of our sponsors that have helped to make this event possible. So thank you to all of our awesome sponsors. And I also want to mention, along with virtual sessions happening throughout the week, we also have DriveThru Distributions or walk-up distributions that you can get that awesome pink Summit tote bag filled with resources and goodies about how we can live in more independent lives, healthier lives. So if you live in Modesto, we'll be in Modesto on Wednesday. If you live in Grayson, we'll be there also on Wednesday. Oakdale, Riverbank, and Ceres. So if you live in one of those areas, you might want to take a note, maybe take a picture of this screen so you know when we will be out at your city to distribute those pink bags, because you don't want to miss out on your opportunity to get this awesome pink tote bag. So a little overview. So again, today we're going to be talking about diabetes, heart health, and stroke. Again, if you have those questions, you can put them in the chat box and I will let Anne know what those questions are when we get to that section. And again, if you have any questions for me, you can put those in the chat box. Again, my name is Jessica. I'm the fitness program coordinator for Healthy Aging Association. So I'm happy to be here to facilitate this meeting. So just a little recap on stroke and heart health before we jump into our diabetes section. So some of these handouts were on our website. So I do want to mention that this recording will be up on our website if you missed any part of it. So will all the other sessions that happen throughout the week. www.healthyagingassociation.org. You can find all of the handouts and information there on our website. So some information about stroke and heart health is also up there on the website. A heart attack, or also called brain attack, it's caused by a block in the blood supply to part of the brain, or could be a blood vessel in the brain that bursts. We do want to mention that, did you know that every 40 seconds, someone in the United States has a stroke? And maybe Anne can attest to that, maybe a little bit more and go into detail if you have more questions about stroke. But Kaiser Permanente has given us a handout that is up on our website so that you are aware of some of the signs of stroke. So if you've ever had a stroke, or maybe you know someone who's had a stroke, you might know some of these warning signs. So maybe you have trouble walking, dizziness, loss of balance or coordination. sudden confusion, sudden numbness, whether that's in your face, your arm, or your leg, maybe severe headaches, or sudden vision changes. And then also there are some things that can be reduced to reduce your risk of having a stroke, but there's also some things that can't be, such as age, gender, heredity, race, or heart health history. But there are some things that can be changed. So managing that blood pressure, controlling our cholesterol, being active, eating well, maybe losing weight, or maintaining a good balanced weight. If you smoke, stop smoking, and reducing our blood sugars. So at this time, I do want to mention that this awesome handout that Anne has provided us with is up on our website if you would want to refer back to it, along with a video recording that Anne has done for us. So I encourage you to check that out on our website later after this session. So at this time, I'm going to stop sharing my screen so that I can let Anne share her slides. There we go, Miss Anne. All yours.
Okay, of course, it's not here anywhere. All right, good morning, everybody. Are you all enjoying the nice, cool weather? Finally feels like fall, right? Okay, so stroke, heart attack, and diabetes all go hand in hand. And we talk a lot about your blood sugar and if you're in control. And the reason really we do that is really to prevent the complications. If you maintain a really high sugar or that A1C for a very long time, you're going to get to complications earlier. So I thought today we're just going to talk about know your ABCs, and they really are real important to talk about the numbers, to what they are and how you can control them to have a better outcome and slow your complications. We just know the prevalence of diabetes is increasing as we go. It's very hard to see type 2 diabetes, which is clearly an adult disease, seeing it in younger and younger children, 10, 12, 13 years old. That's on the rise. Jessica and I were just talking about with COVID, you know, one of the side effects is people didn't get out much and maybe ate more. And so we have more obesity and we have a little bit more diabetes, right? But whether you're here today because you have diabetes or know somebody, thanks for coming. So the ABCs, we're just gonna, and there's probably all the way A to Z, having to do diabetes. Well, we're just gonna do the ABC. So A1C, blood pressure and cholesterol, we're just gonna review that really quick. Your ABC is the best test that you can do to see overall how your diabetes is doing. When you poke your finger at home, maybe once, twice a day, once a week, that's just part of the picture of what your blood sugar is at that point in time. But an A1C does it over 3 months. But how many times a day do you think your blood sugar can be different? So almost every minute of the day, so over 1,400 times a day, your blood sugar could be different. But we're not going to have you test your blood sugar, but we can do this test. So this is probably the most important test you can do to see overall how you're doing. And so we need to change your meds, do something different, take away your meds if it's improved. Blood pressure, yes, it's involved in stroke if we can't control it, or heart attack, and along with cholesterol. So we're going to talk about a little bit of those numbers today and just kind of review for you. And the worksheet does go ahead and kind of have you fill in your own numbers and find out from your doctor to see what your risks are. Okay, A1C. So sometimes the numbers don't mean anything. You're used to the milligrams per deciliter number. So if you already almost always get a 150 or a 100 all the time in the morning, that's your fasting. That should be your best sugar of the day. And then when the doctor gives you your test back, you might be at an 8.0, right? Or an 8.8, which would mean your blood sugar on the average of 1,400 times a day over 3 months is maybe, 170. So just those one sugars once a day, or the few you do them, don't tell you the whole picture. This is important because it reduces your risk for complications. Okay, so the full video shows more on that, but I can answer questions. I kind of want to go and talk just a little bit about blood pressure and cholesterol. But the one thing we need to talk about too is the higher your blood sugar is, the thicker your platelets are. So, and we know that the platelets stick together more when you have high sugars, which mean that they could stick together and form that clot. So people with diabetes are increased 2 to 4 times higher for heart attacks and strokes. And there are American Diabetes Association things as take an aspirin a day, right? That's part of the protocol for people, unless you're on a blood thinner. But that can also help you with that risk. So blood pressure is looked at a little bit different if you have diabetes because of that risk. So we really want the, I'm gonna move your diabetes, your 2 numbers, your top number, of course, is your systolic, and your bottom number is your diastolic. But we want you between like 120 and 80 as close as we can. If you increase, we really need to, your doctor may give you more medications earlier so we can prevent stroke, all the other things come with high blood pressure. And then cholesterol. I know a lot of you get this test done. And if you go to a health fair when we had it, or when we had the Healthy Summit, they do a total cholesterol, but that number really doesn't tell you the whole picture of what's going on. So I kind of breaking this down. Triglycerides for a person who has diabetes needs to be less than 150. And this is really from the food you eat. Some medications might help decrease this, but we can really tell a change if we change our diet, eat less fat, okay? So we have a good cholesterol and bad cholesterol. The bad cholesterol, I should have left that little guy up here. The bad cholesterol is your LDL. So I have pictures here to kind of explain what would be the high. So genetics, right? If certain people in the family might have high LDL, this can add to us being unable to control it by food, healthy weight, and of course, just keeping that below 100. Your good cholesterol is your HDL. So think we want this higher, not less, right? So, and this is increased by exercise, right? And medication can help this. But think of this, I mean, we're all the generation of Pac-Man. So think of the higher your HDL, it's like Pac-Man, eating the bad cholesterol, the LDL. And they always look for that ratio, but that helps. So we can look at your numbers and really see a difference in change of diet, medication, and exercise on all your numbers. So these are real important for your heart health. Okay. All right. And then just work with your doctor. There's plenty of other ABCs I can talk to. Keep your, know your numbers, use that handout I sent. And we are gonna just, work with your diabetes team. If you haven't been to a diabetes educator in a while, ask for a referral. Starting a new injectable, whether it's insulin or non-insulin, it's great to go back and get it. Everybody eats differently, and as you get older, sometimes you eat less. So your medications need to be adjusted, as well as, if you're 70 years old, your liver, your kidneys, everything's 70, right? So they don't filter meds as they used to. And sometimes we have to make those accommodations also. Okay, so I don't know how much minutes I have left, but I wanted to give plenty for if you have any questions, contact me or put it in the chat. Maybe there's some in the chat room now. If so, Jessica can do it. And I'm here to answer questions.
At this time, and there are not, but again, if anybody has any questions regarding diabetes, whether that's your personal diabetes journey or if you have a family member who has diabetes, you can ask Anne, keep those questions in mind or put them in the chat. a couple of things that Anne mentioned that I think is really great for us all to remember, and I have some examples for you. Anne mentioned that it's really important, whether you have diabetes or not, to maintain that good nutrition, make sure that we're eating well balanced meals, to make sure that we're exercising and staying active. So some ways to achieve that physical activity goal and stay active and maintain that good blood sugar level. Whether you're involved in strength training, these are some options here in the county if you're wanting to get involved. Healthy Aging Association offers strength training, Tai Chi, and Tai Chi Quan. And this is focused on maintaining better balance. Line dancing and just walking. I'm sure Anne has seen over her years as a nurse that even walking can make a difference in our overall health. And also making sure that we have options to help us with fall prevention. So we haven't touched too much on fall prevention, but there are some programs out there to help us prevent falls. And, when we have heart complications, or if we have heart issues and we want to maintain good heart health, we have that diet and exercise, but we can also make our home safer with our Dignity at Home program, and making sure that we have good balance so that we can prevent those falls by maintaining those concerns about balance and preventing falls. And then a couple of programs that are offered here again in the county by Healthy Aging Association. The Go Green for Seniors Green Bag program helps older adults receive fruits and vegetables. Also, we do have a nutrition presentation that talks about a different topic each month, so how we can live healthier lives. And we also offer a Food Smarts course. This helps individuals plan balanced meals, also how to incorporate more fruits and vegetables into our diet. So at this time, I want to open the floor. Does anybody have any questions? I see there is a question in the chat. And it says, I am on peritoneal dialysis. My BP gets low because of the dialysis. My doctor's advice is to eat something salty. I'm concerned about being faint when my blood pressure goes too low. Anything else to do to keep blood pressure in the range that avoids dizziness?
Yes, and part of the reason you get dizzy, yes, there's that exchange of fluids, but a lot of fluid change at one time out of your system can make you just have that low volume. So a low volume, whether it's blood loss or dialysis, could be rectified by simply keeping your blood volume up of your liquids, like drinking more liquids before you start, not necessarily the sodium, but the sodium, and hopefully if you're on blood pressure meds are kind of adjusting that, but drinking more liquids and keeping more fluids before you even do the peritoneal dialysis will help you.
I know the question's not here, Anne, but if individuals maybe have been told that they have pre-diabetes, is there anything that they could do
Yeah, that's a great thing, because you guys, if you know how to use your hands, how many of you were ever told that you have borderline diabetes? Right? And some doctors still use that term. I think doctors were afraid that, oh yeah, you're on the road to get diabetes, but we're just going to say you're borderline. So I had this cartoon I use in my classes that shows a lady who's pregnant, and it's like, can you be borderline pregnant? No. So, and diabetes is kind of the same way. Pre-diabetes is diagnosed of any blood sugar fasting over 100, but less than 126 is pre-diabetes. And if you saw in that one of the slides that I showed, we have like 96 million people with pre-diabetes. So if we don't tell people when they're in that very vulnerable time, you're on the road to get diabetes. So let's start eating healthier. Let's exercise. Let's test your sugar more often so we can not get you there, right? So if no one tells you, hey, wait a minute, this is more than just borderline. This could be diabetes down the road if we don't do something about it. But in the past, maybe the doctor never told somebody they had diabetes till they were over that 126. And what a missed opportunity. So probably, I don't know how many years ago, the ADA, American Diabetes Association, said, you know what? We need to call this prediabetes. It needs to be. And even on your lab values, before this really came out, the blood sugar of 125 was considered in range. And now over 100, it's out of range, which should bring your doctor's attention to, hey, and to your attention to also. I mean, they may breeze over it and say, it's okay. But anything over 100 that's fasting, right? Or a random sugar any time of the day of over 150 should be like, maybe I should really pay attention to this. So prediabetes is really where we need to focus a lot for all ages now, since we're having such young kids getting type 2 diabetes as well.
Another question, Anne. Speaking of children, this one goes perfectly. How can we help grandchildren or, children that we look after to not have diabetes?
So screen time would probably be the number one thing, right? With COVID, screen time means anytime the kids are in front of watching TV, videos, on somebody's phone, or they have a little computer, they need to go play, right? I mean, in the backyard, in the house, but they should play. And then if you take care of kids, if you're grandparents to kids, I mean, it's great to have all those things they don't get at home, all those goodies, right? But they're just going to remember doing something with you. So, the baking or the healthy snacks, or, taking that celery with peanut butter and raisins to make it an alligator or something, so teach them how food can be fun, but encouraging taking them on a walk. My grandkids over, they just love in the morning, we just all bundle up and we just walk, let them go play at the park or whatever, but they love to say, we go, at Nani's house, we go walking. So, I mean, it's just getting those kids moving, less screen times, and adding that. The worst thing with parents, it's always like, okay, don't take your kids shopping, right? How many times when you were growing up, did you put food in your kids' baskets, right? I have 5 kids, and even when my youngest was in college, he'd go shopping with me and try to throw all the stuff in the basket. So, it's what we buy. If the bad stuff's not there, they'll eat the good stuff, right? So here we talk about that with Halloween, right? All the candy and everything. But it's so expensive, maybe people aren't buying so much. But anyway, I hope that answers it. I'd like to just say one thing about a sign we're seeing now with too much insulin being made with people on the road to get type 2 diabetes is what we call you see maybe a black ring around the neck, right? So that could be made from like the discoloration of the skin, and sometimes it goes around, but that is from too much insulin being made, and it could be a big warning sign that we need to test your blood sugar, because that will come before you get type 2 diabetes. Okay, so that's something that we watch in the schools too.
Perfect. Any other questions for Anne at this time? Anne, one question. I think this probably could go for diabetes, heart health, and stroke. In the nutrition realm, is there anything that you recommend avoiding or getting more of in our diet?
I think a good way, I mean, everybody knows the plate method, and sometimes, it's just good to review what the heck you're putting on your plate, right? So draw a circle on a page and just put what you had for dinner last night, right? Or what you're making dinner for tonight. And to eat healthier, especially for diabetes, we got to start with what you're currently eating based on, your income, your cultural, but half your plate, by making half your plate green, makes less of those starches, right? And less bread, but more greens and fruit. Take up more of your plate, you'll be healthier.
I think that's a great overall, health, to decrease our chances.
Right? Just really, a diabetes diet is just eating a healthy diet. Right.
And is there anywhere, Anne, that you recommend looking? So when we say a healthy diet, a diabetes healthy diet, if people don't know exactly what that might entail, where should they go to look for information?
Well, I would say go talk to a diabetes educator, because if we just talk about, let's say, your blood glucose index, which is foods have a certain index to raise your blood sugar, but we find out that every individual will react differently to foods. So I use blood glucose testing before and then 2 hours after a meal and what you ate to determine what foods you can get away with and what foods you can't eat so often, because that's for you. You can't eat like your neighbor ate. You may not be able to eat even like your spouse or significant other eats. You got to find out and not worry about what your blood sugar is all day long. That's not how to live with diabetes. It's too stressful. So if you can go see a diabetes educator, they'll help you out.
Great. And again, as I mentioned, Anne has created a wonderful video for us up on our website. So under our Healthy Aging and Fall Prevention Virtual Summit page on our website, www.healthyagingassociation.org, you can see the resources that Anne has provided us regarding diabetes. You can see the resources Kaiser Permanente has given us about heart health and stroke. And you can also view that video. And it might be able to answer some questions that Anne has covered today, some information she's covered, or maybe it could be helpful for somebody you know. So go check that video out on our website. It'll also be posted on our social media. And then at this time, I want to mention it's coming to our close of this session. I can't believe it. Anne has given us so much great information to think about, and maybe some different things that we can do to make our lives a little bit healthier, whether that's preventing heart attacks, preventing strokes, preventing diabetes if you are on the borderline, as Anne mentioned, or how you can manage your diabetes if you already have diabetes. So we hope to see you tomorrow for our session regarding medication management and side effects. And thank you, Anne, and thank you all for joining us today for Diabetes, Heart Health, and Stroke this morning.
Go see your doctor, get your lab work done. Know your numbers.
Thank you, Anne.